Welcome to Chemo Coffee Talk, your weekly dose of resilience, inspiration, and a whole lot of heart. I'm Carly Fouth, a triple-negative breast cancer survivor who started this podcast right from my chemo chair, and now I'm coming to you straight from my kitchen. Whether you're fighting the fight yourself, supporting a loved one, or just here for a little encouragement, you're in the right place. Every week, we'll chat with my cancer-fighting buddies, caregivers, and experts, sharing stories that are real, raw, and uplifting. So grab your favorite mug, brew up some resilience, and let's dive into a conversation filled with humor, hope, and the unstoppable human spirit. I'm committed to continuing this podcast to reach and help as many people as possible. And any kind of support makes a huge difference. So subscribe and share it with friends. Your support keeps me going and helps me spread hope even further. Thanks for listening. Welcome to another episode of Chemo Coffee Talk. I am honored and excited to have Dr. Jeffrey Gross here today to talk with us. He was a guest for my Fit Fun community a couple months ago, and we all really enjoyed the entire session. I think a lot more than we thought we were going to about the topic, but Dr. Gross was extremely engaging, and we did talk a little bit. He mentioned something about cancer patients, so of course I thought, okay, I think he needs to be a guest on Chemo Coffee Talk. So welcome, Dr. Gross. I'm just going to give you a little introduction that you included when I asked for a bio. So this kind of sets up the type of guy Dr. Gross is, because he has a great sense of humor. He said he's just a simple country neurosurgeon trying to make a difference. So he's going to talk to us today about regenerative stem cell medicine, and he's also an anti-aging specialist. But I'm going to let you, Dr. Gross, give a little better intro of exactly who you are and what you do.
Yeah, thank you for having me back. It's great to see you, and hey, hi to everybody. Please call me Jeff. This is informal, and I'm not a doctor for you today. So it's just
Okay,
Jeff
great.
and Carly at Coffee Talk. So I'm a bio nerd. I get up in the morning, I have my morning coffee, and I read the latest research on things. And even though historically I'm a recovering neurosurgeon, I do so much more than that. I'm not just dealing with neurosurgical problems. And that happened about 6 years ago when I embraced and opened my mind as to stem cell-based medicine, or what we call regenerative medicine. And that is much more than just stem cells. For the purposes of helping my spine patients, because I treat a lot of neck and back trouble. And it has blossomed into treating joints and other problems, and now inflammatory issues, cancer being one of them. And we have some very interesting cutting edge immunotherapy tools that we'll probably talk about here in our coffee talk in the regenerative space that are, I think, very exciting as an augmentative or alternative or preventative help. And I have to say help because these are not yet approved for marketing claims by the FDA. You can do them. We talk about informed consent, but they're not yet approved for advertising marketing, which is what the FDA regulates.
Mm-hmm. So let's dive in, because I think a lot of people are in the same boat I was when you came to talk to the Fit Fun community. But I had heard about regenerative medicine, but I didn't really understand what it was. So can you explain what exactly regenerative medicine is and how exactly it can benefit cancer patients during or after treatment?
Sure. So regenerative medicine is learning from our own biology of what happens as a fetus grows and develops, or a young child grows and develops, or an adult maintains, repairs, and restores, because we heal ourselves all the time. But we lose that over time in older years. And there are a couple different things we lose. We lose our stem cell numbers. We lose our stem cell activity. They're not as good. And we lose our natural killer cell activity. And for those who haven't heard of natural killer cells, or NK cells, they're a very small percentage of our immune cells, our white blood cells. Their job is to go around the body and remove abnormal cells selectively. Don't hurt normal tissue. That would be accidental cancer cells that we make throughout our life, until finally someone has too many cancer cells and it gets a foothold, and our NK cells can't take care of them. So, and they also NK cells remove zombie cells, senescent cells, all of these coming from inflammatory damage. So as you get inflammatory damage, you're more likely to have cancer, and or disease or age-related disease. And as you have more inflammatory damage, your stem cells and your NK cells aren't working as well. So we learned from that, and now we have cheat codes or hacks or strategies from that we can reapply to jazz up our immune system, fight disease, fight inflammation, fight cancer, which is actually the whole basis of anti-aging.
So interesting. So interesting. So let's talk a little bit about cancer treatments. So chemotherapy, radiation can cause long-term damage to tissues, joints, and the immune system. So how can regenerative therapies help mitigate these side effects?
Well, most of the regenerative therapies fall under two main categories for addressing or helping to address cancer. One would be sort of this concept of nudging taking stem cells, nudging them backwards along their embryonic pathway through a process called induced pluripotent stem cells, or iPSCs. And if you go to your web browser and type in iPSCs, anything that we're doing in the US, at least, and other countries too, on the research side for cancer in stem cells is usually in that genre, where we take some little peptides, little growth factors in a petri dish, and we convince those cells that they're younger than they are, and they have more power, and there are a lot, and then you can rev up those cells and make them identify cancer and remove it. So that's a very labor intensive, a lot of steps, a lot of labs, and it's under research right now. And that's very interesting. The other broad topic is called immunotherapy, where we're jazzing up or taking advantage of some benefits of our immune system that aren't working as well. That's where the NK cell type of things come in. There are other things. There's something called CAR-T, C-A-R-T, which is where you basically create kind of a genetic, you engineer some cells of yours, T cells, immune cells, and you put a gene from your cancer. So you need some cancer tissue. So again, labor intensive, a lot of work in the lab. And you basically cause those cells to make those T cells to produce some cancer protein, and then your body has a better immune response against the cancer. So what I'm looking for is something more efficient. Being a clinical practitioner and a simple country neurosurgeon, I wanted to keep it simple. We're tapping into these natural killer cell exosomes, and exosomes are cell-to-cell signaling particles. It's a little bit of a membrane, growth factors, peptides, proteins, and in NK cells, some what we call lytic enzymes. So basically, if an NK cell encounters a cancer cell, it deploys these smaller, not that cells aren't small already, but even smaller, about 1,000 times smaller, these extracellular vesicles, these cell-to-cell communicators, thousands of them, go into the cancer cell. The cancer cell takes them in. If you remember your high school biology, through endocytosis, it takes in their parts and uses them. And then that cell, those enzymes, cause that cancer cell or that zombie cell to rupture, die, and its parts recycled, and it's out of the system. It doesn't harm normal tissue. And we've shown this in petri dish. We've shown this in animal models. It's both for circulating bloodborne cancers, and you can inject it into solid tumors. So
like a breast cancer patient could,
a breast cancer under image guidance,
any tumor,
lymph node, liver, anything. And the results in the lab and the animals are fantastic. There's one study in China in humans, but it's been very difficult to get our hands on these NK exosomes because it's an off-the-shelf treatment. Basically, it's off the shelf. So we now have some. We finally got some very recently because you can only get them in China and Europe. And we got them from labs that meet the European version of the FDA, all their stringent testing. So we have some, and we can make them available to people who want to do something different, add something, maybe are in remission and want something preventative. There was one study of using NK cells, not the exosomes. I do want to mention the one study they gave NK cells to patients and measured their age-related blood markers and found that the cellular activity became more youthful in those patients, lasting months and even up to years. So that was the cells. We can go right to the exosomes, which is the business end. And this is a very exciting area. We're actually putting together a state-of-the-art imaging injection center where we can do the solid tumor injections and things like that with these NK exosomes.
So is this something that you can do alongside traditional cancer treatment like chemo and radiation, or is it one or the other? Or it's
No,
okay.
we see this as an alternative if someone
Hmm.
doesn't want chemotherapy, radiation, maybe he's not healthy enough, maybe doesn't have the kidney function for it or the heart function. We see this as an augmentative to help the body do better cancer killing, maybe in between cycles, or maybe in periods of rest uh, after that, or maybe after or before or both. And then we see this as, again, the preventative. So we see it in different things, and we can add, if anyone's interested, we can add ivermectin, we can add vitamin C, other anti-inflammatories like natural, like curcumin. So
Hmm.
NK cells are natural, curcumin is natural, vitamin C is natural, ivermectin's not, but you don't have to have that if you want an all-natural approach too.
And are there any side effects? Like if somebody was getting this done, do you feel different or is it no?
No,
So,
no side effects yet. Now, as
okay.
we do more of this, we're gaining experience. This is the tip of the spear. It's the bleeding edge of applying regenerative medicine in a very new way. I mean, this the research goes back 5-6 years, but making it available sort of clinically as a sort of compassionate or alternative for patients who understand everything. We have a full informed consent process. We just can't make any claims that we're curing cancer. Not that any oncologist with chemotherapy can make the same claim, right? That's the
Right.
silliness of this whole, how people view the FDA.
Yeah. Yeah. Let's talk about pain because chronic pain and just issues after treatment are really prevalent. And I know myself, I have I feel things that maybe I didn't feel before treatment. So how can this help aiding in pain relief in physical recovery from treatment?
Depends on the source of the pain, right? If the pain is from, tissue destruction or nerve involvement or something else, and then we deal with it directly. So it just depends.
Hmm.
We use different stem cell derived exosomes, not the NK type, for musculoskeletal pain. So we can look at the source, confirm the source, and then there are things we can do directly, usually injection based. But again, it just depends. And if we're healing the tissue and removing the bad stuff, the body's great at repairing when it's in optimal mode. If it's
Hmm.
been hurt by chemotherapy, then it's not as optimal. So some of these regenerative approaches will help the body, rev up the immune system, return back to a healthier state after the damages from chemotherapy. Not that chemotherapy may not have a role, it does in many cases. It'd be nice if we could, lessen our dependence on chemotherapy downstream, but it's still here and it's still a standard
Hmm.
anytime, depending on the cancer type.
Yep. Where do you see the role of regenerative medicine evolving in cancer care, and what breakthroughs are on the horizon that you think could change the way patients recover and thrive after treatment? So, like, what can we look forward to?
Yeah, I think what I told you about the NK cells and some of the other approaches in the immunotherapy side of things, and then the recovery side of things, right? You're done with cancer, and then you go maybe through a process. Think about a sci-fi movie where someone's injured and they put them in this, like chamber. It's like an
Yeah.
amniotic chamber, and
Yeah.
the body gets healed. I mean, that's what we see, right? You go through this destructive process to kill the cancer, then we need to give the body back its youthful, cellular behavior. These in the next number of years, within the next 5 to 10 years, all these things are, I mean, this is a blossoming area. And as much as, big pharma likes to hold it back, it's we've broken through the dam. It's happening, and it's happening faster in other countries, but I read their research as well.
Yeah. And I think a big question, and I know I have this too, with a lot of things, is you hear somebody like you talk about what we're talking about today, and somebody says, that sounds great, but like, how can I get that? Like, where do I go? Who do I see? How can I find somebody that can help me with that since it's not as prevalent as like a chemotherapy or a traditional approach? So what would you say to
Yeah.
that person?
Well, the kids say, if you know, you know, and they
Hmm.
do it in abbreviation in the text. And I have no
Yep.
idea what my kids are saying half the time in text. But if you know if you're listening to this and you're learning and you're researching on the internet, you can find a regenerative specialist near you. We are all over. I have colleagues throughout the United States, and you can see what they have access to. We've been pushing for these NK cell exosomes, so I think I'm one of the few that have them. There are clinics that have NK cells. I just met with a physician who has a clinic in Mexico who has NK cells, but you don't have to leave the country for those things. And again, the cells have to be activated. The exosomes are already ready to go. So they're off the shelf. That's so much more efficient because you can just come in and have an IV, for example. So, and most of my patients are remote. So if you just want to talk, have a 30-minute conversation. Carly, for anyone in your, audience, for the first, I'll say 30 people that call us, I'll be happy to have for no charge a 30-minute conversation.
Oh, awesome.
We'll
That's
talk.
super nice.
Love to meet new people. I don't have to. I know I shouldn't have been a surgeon. I like to talk to people awake, not asleep. So
Yeah, you don't come across as like the typical surgeon.
Probably I got dropped on my head as a baby or something. But
that's great. That's so generous of you. I actually have a question, and I don't mean to sound dumb if you did mention this before, but I'm so interested in those natural killer cells because I was doing my own research before I even met you. So can you explain to me and again, you may have said this before, but when you're saying you have the cells, where are you getting them from? Like who are they coming from?
We have the exosomes. They're from an approved lab in Europe, and they come from screen donors, people who have not had the COVID vaccine. So they separate out the natural killer cells because natural killer cells have a surface marker that identifies them as separate from all the other cells. So they can be separated out through like an antibody filtration process where the antibodies grab onto those cells. Now you have only those cells. You have to run a lot of cells through there to get just a little bit. And then those cells then are usually put into some type of flask or petri dish, and then they are given nutrients, and those cells then produce these exosomes. Sometimes you put a little interleukin-6, these sort of priming peptides and things to get them to do that, and then you collect the fluid away from the cells. So we don't have any cells. We have the fluid, and then from there they filter out by size and centrifugation when they spin around the exosomes, the smaller particles. So we have those NK cell derived exosomes, not the NK cells. NK cells need to be activated. I don't have the lab space for that. I don't have to hire 3 people to do that. So this is off the shelf. So we have them here in our -30 centigrade freezer. We're ready to rock.
That's fascinating. And one more thing. It's true, right, that exercise boosts your natural killer cells?
Totally. It boosts your stem cell activity, builds your NK cells. Anything in the hormesis family. Hormesis means a little bit of stress to your cells to build resilience and to build health in your cell population, to have a more youthful cell population. So NK cells will do that. So activating your NK cells will give you a more youthful cell population, so you're biologically younger. So high intensity exercise, resistance exercise. It doesn't have to be hours of running, and we're talking about a 20-minute HIIT exercise regimen and some good resistance. I like resistance to failure. I'd much rather do 1 set to failure than 3 sets of 10. It's at that last set where you do most of the work. Your muscles release little peptides called myokines. They help prevent dementia. They help the heart work. They help everything. They're anti-inflammatory. And then other hormesis would be hot sauna, cold plunge, fasting. And if you're diagnosed with cancer, the first thing you should do is go on a 3 to 5 day water fast. It sounds like miserable, but that's what you need to do. Your body will do a lot of the work in clearing out some of those cells you don't want.
Interesting. You're fascinating to talk to.
Well, thank you.
You're so easy to talk to, too.
Thank you. Well, I'm glad we didn't open up the dad jokes because I can hear my wife roll her eyes, like it makes a sound when she does it. So
no, I love it. This is fascinating. Thank you so much for sharing what you do. And then can you just again say where people can reach you or find you if they would like to take advantage of that 30-minute call?
Absolutely. So our business is now called Recelebrate because you're celebrating the renewal of your cells. So that's RECELLEBRATE. And I think we're the only people using that word with that spelling. So if you go to your browser, okay. So recelebrate.com, that's our Instagram. Please follow us. And you can reach me there too.
I'll put it in the show notes as well.
All the socials. We have YouTube stuff out there too. I do a lot of musculoskeletal, so you'll see some talks on cartilage regeneration and stuff we've done, and some examples of befores and afters where the cartilage thickens up. All kinds of cool stuff.
I love that. And I love that we ended on the exercise note, as if people needed any more reason for me to move during cancer treatment, and the importance of exercise but before and after is you want to get more of those natural killer cells. So take that. If you didn't take anything from this, take that. Everybody Great. Move. Thank you so much. I was going to call you Dr. Gross. Jeff. Thank you, Jeff.
There you go. Okay, right on.
Thank you so much
for having me. And anything I could do for you or your audience in the future, please reach out.
Thank you so much. Thanks for joining me today on Chemo Coffee Talk. I hope this conversation left you feeling inspired, uplifted, and a little more connected. Don't forget to subscribe, share this episode with someone who might need it, and leave a review. It helps me reach more people looking for hope and resilience. And remember, no matter what you're facing, you're never alone. Until next time, take care of yourself and keep moving forward.